Good morning and welcome to everyone. It's great to see everyone here, many old faces that I enjoy seeing every year at this symposium and some new faces. It's great for you to come out on this soggy morning. Whoever said that money doesn't fall from the sky doesn't live in the western United States, so even though it's wet and soggy, we're all happy to see it. Your attendance is greatly appreciated, and it's a privilege to co-host this program for you this year with Santa Rosa Memorial Hospital, joining with NCMA, and I'm privileged to have co-hosting with me Tuck Bierbaum. And I hope you enjoy this symposium and take away information that's useful in the management of your patients. You really represent the healthcare backbone of our region, and we forget that our region encompasses about 8,000 square miles and almost 800,000 people spread over all the small cities and towns in the three-county area. And so we really appreciate what you do. Those of us in specialty practices appreciate the difficult work that you do in your clinics, and I hope that we can serve as a resource for you. Northern California Medical Associates and Santa Rosa Memorial Hospital are really committed to delivering the highest quality of medical services to this region and beyond. So please do consider us a resource to help with you in your practices and to help with your patients. A few announcements as we get started here. Thank you to the speakers who've agreed to talk today, and we'll look forward to their presentations. Take a look at the agenda and note that we'll try to stay as on time as possible, and think about your questions and be interactive with our speakers. Also, thank you to our sponsors. Without them, we really couldn't carry this meeting on. There is a fair amount of cost associated with it, and you're the beneficiaries. So thank you to Medtronic Cardiovascular Group, the Medtronic Endovenous Division, Stryker Neurovascular Division, Stryker Craniomaxial Facial Division, St. Jude Medical Cardiac Rhythm Management Division, Boston Scientific Cardiac Rhythm Management Division, Actelion, AstraZeneca, Bristol Myers Squibb, Janssen, LabCorp, Novartis, Novo Nordisk, Roche, and Zoll LifeVest. Also, our AV guy, JP, stand up, has done this every year, and JP Montemayor, who is our AV person extraordinaire, and we appreciate his involvement. He makes all of this run smooth and makes us look good, which could be hard to do. So please visit the exhibits on the breaks and in between time, hear what they have to say.
Good morning. Forgive me if my voice isn't carrying. I had laryngitis, and I had a conversation with Tom last night about 8:30. He recommended whiskey and lemon, and I chose hot brandy and lime, but I can talk tonight. So I want to echo Tom's comments. It's really a privilege to have all of you here, the frontline physicians in the region, whether you're emergency physicians, nurse practitioners, PAs, primary care physicians, internists, family physicians, pediatricians, have a real challenging task of providing for a broad range of diseases, often in remote areas, without full specialty backup. The St. Joe's Health System Regional Referral Program accepted over 3,000 transfers from you last year. What this program is about, it's what we call Regional Referral 2.0. It's not just accepting those transfers, but trying to share clinical information and share clinical initiatives with you that will improve the quality of care of everybody in the region. There's a motif to this conference that what we learned with trauma care and confirmed with STEMI care now also applies to stroke, sepsis, and pediatrics. What I mean by that is the early recognition of disease, the early institution at sending facilities of appropriate therapy, the sharing of clinical information, and then the rapid transfer without barriers to tertiary facilities are going to affect the outcome of people in your community in a very positive way.